Good afternoon. Welcome. Good morning, good evening, whatever time zone you're in. We are welcoming you to our maternal mental health webinar series, delving into maternal mental health. Today's topic is military families and maternal mental health. I have a fabulous panel of women joining me today from all around the globe. We have somebody from Portugal, we have somebody on the West Coast, we have somebody from Japan. And so we are just super excited to welcome all of you to today's webinar, which is being recorded. My name is Adrienne Griffin. I'm the Executive Director of Maternal Mental Health Leadership Alliance, and I welcome you and give thanks to the sponsors of this webinar series, the California Healthcare Foundation and GE Healthcare. Next slide, please. So at the bottom of the screen, you will see the Q&A button. Please go ahead and ask your questions in there. There's also the show captions button, so you can see live captions, and the reactions button. Please use that to share an emoji if you want to. Next slide, please. So just a word or two about Maternal Mental Health Leadership Alliance. We are a nonprofit, a 501c3 nonprofit, dedicated to improving the mental health of mothers and childbearing people in the United States by focusing on national policy and health equity. Next slide. Our 4-part webinar series started in August. It's wrapping up today. We had some great conversations about birth trauma, about pregnancy, disability, and maternal mental health, about pregnancy and infant loss, and today about military families and maternal mental health. This information is available on our website with recordings of each webinar and associated fact sheet. Next slide, please. And today, here's what we're going to cover. A quick overview of maternal mental health, and then a deeper dive specifically about maternal mental health among service members, spouses, and women veterans. We're going to hear a few stories of lived experience, and then we're going to talk about some projects that are aimed at supporting the mental health of our nation's military mothers. Next slide. And then after this webinar, we will email you a brief survey. We will share this PowerPoint presentation as well as a recording of the webinar, and then our new fact sheet about military veteran women and maternal mental health. Next slide. As with all of our webinars, we know that some of this information can be challenging. We talk about maternal mental health complications, the impact on ourselves and on our families, and so please take a break as needed. Next slide. So I am thrilled to welcome a terrific team of presenters today. We have Tiara Flynn, who is an Air Force veteran. She's going to tell her story of her lived experience with maternal mental health issues. Patience Riley, who is an Air Force spouse. She also has lived experience, but she's also a licensed professional counselor who works a lot with military families. Gabby Cavins is a Navy veteran and the executive director of the Military Birth Resource Network and Postpartum Coalition. And she and Jamie Zale Belcito, who's the founder of MMHLA, are both going to share projects that have been launched to support the mental health of our military mothers. Next slide. And here, just to let you know, I too am a military veteran. These are heretofore unpublished photographs of when I was in the Navy. On the left is when I was a midshipman at the Naval Academy. I see some hearts and claps going up. And then at the right, my last job was working at the White House. And so that's me at Christmas time in 1992. So, oh my gosh, it's hard to believe that that was 30 years ago. I haven't changed at all, right? So thank you for sharing those. Next slide, please. And thanks for all the hearts. Okay, so let's get serious now. We're going to talk about key facts about maternal mental health. Next slide. So most of you probably know these facts, but just to level set all of us, we know that 1 in 5 mothers are impacted by mental health conditions. And in fact, mental health conditions are the most common complication of pregnancy and childbirth. We also know tragically that mental health conditions are the underlying cause of maternal deaths, with suicide and overdose combined as the leading cause of maternal mortality. Next slide. We also know that the cost is significant. $14 billion each year in untreated maternal mental health conditions. And we know that 75% of those impacted by these conditions never get treatment, remain untreated. or if they do receive treatment, it's not treatment to symptom remission. Next slide. We know that certain individuals are at increased risk for experiencing maternal mental health conditions, including people of color, those impacted by poverty, and military service members, their spouses, and women veterans, which is why we're doing today's webinar. And just a side note, I have wanted to do this webinar and share this fact sheet for many, many years. My personal experience, friends of mine who have been in the military, it has been an issue that has been near and dear to my heart. And so I'm really just so pleased and so grateful that we're actually addressing this issue today. And of course, we know that it's not just postpartum depression, that there are a range of maternal mental health conditions, including anxiety, obsessive compulsive disorder, PTSD, particularly among our military populations, as well as bipolar illness, psychosis, and substance use disorders. So we like to say it's not just postpartum and it's not just depression. Next slide. And then just a few details about military families and maternal mental health. Next slide. So we have three specific groups of women when we talk about our military mothers. So civil service members who are on active duty, their spouses, often referred to as dependents in the military parlance, and veterans. Those are individuals who were formerly on active duty and who are no longer in uniform. And so we see what the numbers are. I just want to focus on the bottom line. We see that about 16,000 service members give birth each year, about 85,000 dependents, and about 10,000 women veterans. Next slide, please. So I want to talk about military culture. It's really important that we understand the unique military culture to appreciate the impact that it can have on our women service members and women veterans. So the military culture has a lot of very positive aspects. We hear about esprit de corps, semper fi, always being ready, leave no man behind. There's some really fabulous aspects of the military culture. However, the hierarchical and sort of male-dominated culture that impacts all aspects of life can really not be friendly to mental health issues, and particularly for maternal mental health issues. And that's why we're focused on this today. The military culture impacts all aspects of life. Military members often live and work on base. It's a very tight-knit community. It impacts not just the service member, but all members of the family with frequent moves and deployments. So it really is a culture that is all-encompassing, and it is hard to get away from. Next slide. So just a few facts, some quotes that I found as we were writing our fact sheet on maternal mental health. And again, I don't want to be like, painting it as such a negative picture, but it's really important to understand sort of the unique aspects of military culture and what it means for mental health conditions. So for example, service members are expected to be always disciplined in their actions and words. And this is really important because, in time of war or in conflict, when your boss says, when your lieutenant says to do something, you do it, right? Because without question, because that is what the military does. But you are always supposed to be in control of their actions and words, and particularly their emotions. Also, in the military environment, individuals who are perceived to be not mentally or physically tough can actually be looked down upon or ostracized. And in particular, experiencing mental health challenges can actually be seen as a sign of weakness or lack of professionalism, which are really the antithesis of military culture. Next slide, please. Because of many of these reasons, we know that military mothers, both active duty and spouses, are at increased risk for maternal mental health conditions. A GAO report from 2022 showed that 35% of military mothers, both service members and their spouses, experience maternal mental health conditions. And there was one study that was cited that shows that 50% of mothers with deployed spouses experience postpartum depression. Well, you might imagine if you're a new mother and your spouse is deployed for typically 6 months overseas or on a ship. And, oftentimes, the military career coincides with the childbearing years. And so the active duty member may be deployed during the birth of the child or after the birth of the child. And so, military spouses are typically, many times, often single parenting. Next slide, please. So again, what about the military culture makes it so unique that it increases the risk of these maternal mental health conditions? Well, we talk about the frequent moves and separations. Families are often distant from their family of origin, so they don't have a built-in social support system. And that lack of social support with either a spouse being deployed or not having a family in the area is significant. These deployments and temporary duty assignments bring a lot of disruption to the family structure and routine. You can imagine if you're a family with, two parents and little children, and one partner deploys for 6 months, and the stay-at-home parent, is the single parent and runs everything in the household. And then the other partner comes back from deployment and has to be integrated back into the family structure. It can be very, very disruptive. There's always concern about the service member who may be in harm's way. And there's particular stress for dual military relationships who may be, both trying to figure out how to navigate their career with deployments and temporary duties and all of those different things. Next slide, please. There's also specific barriers to care that are unique to the military. The military culture emphasizes self-reliance, strength, and hierarchy, and service before self. And so oftentimes the military service member who may be experiencing mental health conditions is really reluctant to acknowledge them, specifically because they're concerned about how those mental health conditions may impact their career, their security clearance. These are real issues in the military. There's logistic barriers such as childcare and transportation. Again, if you're single parenting, how do you arrange for time off from work or for somebody to take care of the children so that you can get to mental health appointments? And the lack of availability of specialized mental health care, particularly if somebody is deployed. So there's a lot of significant barriers to actually accessing mental health care. Next slide. We know in particular that service members are at high risk for two specific reasons. Studies show that women who have a personal history of deployment, meaning they've been sent overseas, whether on a ship or on the ground, experience maternal mental health conditions at twice the rate of non-deployed service women. And as many as 40% of women's service members report experiencing sexual assault, which we know that kind of trauma can lead to mental health conditions during and following pregnancy. Next slide. So the impact on female service members in particular is significant. Not only do they perceive stigma related to mental illness, but also stigma associated with gender. If you remember the slide I showed earlier that showed the number of women on active duty, it's still very much a minority, less than 17%. And so with that, always, whenever there is a minoritized situation, there comes with significant stigma. And showing emotion, being vulnerable, feeling fear, all of those things are associated with femininity rather than the masculinity that underlies the military mindset. And again, I'm not trying to throw shade on the military. The military is fabulous, but this military culture can really be sort of a deterrent to acknowledging mental health conditions and seeking help. Next slide. So here are just a few quotes that we found doing research for this webinar and for our fact sheet. And these are things that the military spouses or their dependents, or military women or military dependents have said. You're not allowed to have depression. You're not allowed to have anxiety. You just have to hold it in and get the job done. The one on the lower right is actually my quote. I was afraid if I took an antidepressant medication that I would lose my security clearances. I was an intelligence officer. I had very high security clearances, and it was a real fear. Acknowledging mental health issues, especially, this was a few decades ago, really meant that I was saying the end of my career as an intelligence officer. So these are, significant issues in the military. Next slide, please. So now we're going to turn to two of our panelists who have lived experience with both being in the military as an active duty service member for Tiara and as a spouse with patients. And each of them is going to talk a little bit about their experience and what they have done with their experience to help other new mothers. So first up is Tiara Flynn. I'm so thrilled to welcome her to the podium or to the stage here. Next slide.
Thank you so much, Adrian. And thank you for sharing your pictures earlier, because that makes me feel better about my throwbacks.
Yeah.
You look amazing, by the way. Thank you to MMHLA and the fellow panelists that are here, and everyone for joining us. We're excited to, I'm always excited to partner and collaborate with MMHLA, because we're spreading awareness, and you guys do such a fabulous job every single time. So.
Oh, thanks, Tiara.
Thank you
So
for
happy to
inviting
have
me
you.
once again.
Yeah.
My name is Tiara Flynn, and I am an Air Force veteran, as Adrian mentioned. I'm born and raised in Las Vegas, Nevada. I currently live in Las Vegas. I moved back home in 2018. Just to give you a little bit background about my full story, I joined the Air Force right after high school, because living in Las Vegas, you feel like you're going to go into gaming or maybe somewhere else that you shouldn't be. So I didn't really feel like college was like something that I wanted to do, growing up around professions and things like that, where there's fast money and not a lot of background in education, to be quite honest. So Air Force veteran. Right after high school, my grandfather was in the Air Force. He's there in the picture with me in my uniform at my basic training graduation. My dad is also Air Force, so that's how we ended up in Las Vegas. He's Brooklyn, born and raised, and moved us to the West Coast, to the desert, to Las Vegas. So that's how I got here. And then kind of a full circle thing, following in both of their footsteps and going to the Air Force. When I finished basic training and tech school, I was very excited to travel, very excited to move somewhere, very exciting. Obviously, all these possibilities were mentioned to us. And I will remember this day forever. In tech school, they kind of take you in a room and give you your duty assignment, and they just seem so excited. I don't know if it's because you're getting out of basic training or what, that they're kind of hyping it up and amping it up. And I will never forget the training instructor saying, like, you're going to one of the most exciting cities in the country. And he was so excited. He said, you're going to go to Nellis Air Force Base. And I'm like, as in Las Vegas, Nevada? Like, is there another Nellis? Because this feels like a practical joke. I was devastated because I wanted to travel and I wanted to see different things. And I know that Vegas is an exciting city to most. And it is to me too. I mean, it's home, but I was just very shocked. So that was the start of my journey in the Air Force. I spent 5 years at Nellis. And this will play into my full story a little bit later, because when Adrian was mentioning like being moved from your family and things like that, obviously my first 5 years, I was right at home. I never lived in the dorms. I didn't have to worry about traveling, taking leave for the holidays and things like that. So I was very, very comfortable the first 5 years of my military career. I did deploy 2 times while I was here. One time I went to Djibouti, Africa, and then another to Afghanistan. So I did move, did get to work in a rescue squadron where they took me on various TDYs and deployments. But being at home, definitely, I got to return to my home church, and just that added level of comfort was very good early on, and I didn't realize, how spoiled I guess I was. After 5.5 years of being in, I finally got ordered. I was going to get out. My dad owns a marketing firm, and I started to like kind of work back into that fold. In a leadership aspect, I knew when I left the military, I wanted to be a business owner. I didn't consider myself a lifer. So I wanted to go into business ownership, and what better way than to be under the mentorship of my dad. So I started to kind of work on that transition a little bit mentally. Didn't really make a decision yet. And then I got orders to Okinawa, Japan. So talked to my dad, thought through it, prayed about it, and he absolutely was like, you have to go. Look, they pulled this Brooklyn kid into Nellis, and I got stuck here and stayed here. I almost felt cursed because my dad was here for like six years until he got orders to Hill, which is another desert, if you're familiar. So he stayed here for 9 years. So went to Japan, wonderful experience, beautiful experience, but a huge transition, right? Because I went to basic training and tech school here in the States, and then got stationed back home. And to me, my first official like assignment was Japan, because it was overseas. So not having that family setting, I wasn't married at the time, didn't have any children. The military, the people you work with, they become your family. So that was an incredible experience. I spent 2 years there. I was dating my husband when I was at Nellis towards the end of that time. So he did the smart thing and came all the way to Okinawa to ask me to marry him. So I did get married while I was in Okinawa. And then his orders carried us to Edwards Air Force Base in California. So back to the desert, like the desert's just always calling me. And that was a unique experience as well, because again, here I was like trying to, wanting to be overseas and wanting to like grow in my career, because I didn't really feel like I did that at Nellis. I was at home. I was on base for work and I went home. I didn't like get to know my coworkers like that, you know, like that community feel that everybody always talks about, like having family as your fellow service members. I didn't get that feeling until I got to Japan. So being sort of plucked out because we got married and his orders carried to Edwards, that was another hard, like a really harsh transition, you know? And it was interesting because this wasn't in my notes, but when Adrian was mentioning those 3 different groups, I'm like, oh, okay, I kind of experienced all 3. I was a service member. When I got out, my husband was still in, so I became a spouse and then also obviously a veteran. So I never really thought about having those 3 different identities and how they impacted me as a person. And so Edwards was where I got pregnant with my first child, my son. And while I was in Okinawa, I didn't mention this, I used to mentor middle and high school kids, and majority of them used to come to like these after school mentoring programs because their parents were dual military, and they were perceived as like problem child or kids that were just having a rough time. And so that stuck with me. I also had a coworker who had just had a baby, and we worked in a double vault situation. So she just had a baby, she was nursing, and there was no environment for her to store her milk. All of these different interactions I would have with women back then, they stuck with me. So the minute I got pregnant, I started to process that coworker who was having a challenge with the on-base childcare, the coworker who didn't have anywhere to really store their milk, or she had to leave our vault situation and go nurse and then store her milk, and everybody was just giving her such a hard time. So I like to say that I really had like a discernment early on, or like just a thought of, when I get pregnant, I'm going to make this decision, this plan. I felt like I had everything pretty laid out. So as soon as I got pregnant with my son, we started to talk about it as a family, and I decided to exit the military. Again, a very harsh transition, seems like on theme for my life at this point. But it just felt like the right thing to do. And as soon as I gave birth to our son, my husband got orders to Florida. So I left the Air Force. Again, this community, this family, because I always tell people, when you leave the military, it's not like leaving a job in corporate America. It's not like leaving a job anywhere else. You're leaving truly a community. I love that Adrian put emphasis on that earlier, because it's just a completely unique experience. It's a completely different, it's just a different way of life that not a lot of people can understand. We know, you know, the percentages of service members in the US, and then just women, and then Black women from there. So I completely underestimated leaving and then having to PCS to Florida, where I'm being brought all the way from the West Coast to the East Coast, or somewhere else once again. Right when we got there, I mean, I didn't really have anything else to do, so we got pregnant again. And so back-to-back pregnancies, back-to-back births. Again, I think of myself as someone that very strong person. I come from a family of 8. I was raised by a single dad. Being in the military, I'm sure a lot of us feel this way, where we're like, I have seen some things, I've done some things, I've accomplished some things. So when you have children, you don't feel like, well, I didn't anyway. I didn't feel like these tiny little beautiful creatures would be kicking my butt, but they were. So still not really processing that. When I was in Florida, my husband had a very demanding job as far as travel. And so he was gone constantly, regularly. And really organically, I started to, I did a couple of Facebook Lives, again, because I'm at home by myself and I was kind of like tired of PBS and talking to babies that can't talk back to me. So Facebook Live it was, and I did one that my friends to this day, they were like, it was so funny and it was so great. And it was so, that's my defense mechanism, if you can't tell by now, it's like trying to make people laugh and trying to make other people feel good because I wanted to feel that way. But really, I was struggling and I was having a really challenging time being at home by myself, not having a sense of purpose, right? Like, because everybody assumes that the minute that you have children, you feel that purpose. You feel purposeful in being a mother and feeling like, oh, I know that I'm supposed to be here to be their mom. That doesn't happen for everybody automatically. And for some of us, it doesn't happen at all or for a long time. So I felt like I didn't really have sense of purpose. I didn't feel like I mattered, you know, and other than to nurse these kids, make sure I keep them alive. And that was it. That was like the day's purpose, right? I did the Facebook Lives and I was very shocked at what the inbox response was. Because again, on the Facebook Live, people are like, they're laughing, they're having a good time, they're sharing hearts, whatever. But in the inbox, there were people reaching out like, you know, I'm really struggling as well and having a challenging time. Just to dial it back into my story just a little bit, when I first got pregnant with our son, I did the thing that I thought, you know, I was supposed to do, find resources, went to the childbirth education classes. And that's when I learned, and that's when I met a doula and I learned what a doula was. So when I had our daughter in Florida, I felt even more prepared, went to a birth center, had a midwife, had a Black midwife, like all of these things that I read and all these things that people are like, do this, do that. So that way you can try to prevent postpartum depression, anxiety, all these things best you can. So I felt very prepared, and it still really snuck up on me and still really hit me. And it really dials back to that feeling purposeful that I was talking about. It wasn't just about me helping myself, it was about me helping others. And the midwife that I'm sorry.
I'm sorry. I was just wondering, Tiara, if you could tell us, so how did you transition then to becoming a doula?
Yeah, so the midwife that I was with, it was such a different experience than going into an OBGYN office. And that's not like to be no shade to that way, but it was more personable. We sat, we talked, she did my checkups and stuff like that, and that was great. But I felt like she was really getting to know me. I felt like we were close and she really cared. And so that organically became me just kind of hanging out. Again, I'm in Florida. I don't know anybody. I didn't meet any friends. I don't have any coworkers. I would be at the birth center hanging with my midwife when I didn't have an appointment, and just like kind of being nosy to other women in the waiting area. You know how you do, and you're like, oh, how far along are you? Or just, but my interaction with them, from what she told me and what I could feel, was just a little bit more. I wanted to support them because, again, I'm feeling like I thought they were like me, where it's like they don't have community, they don't have family, they don't have support. So I really do feel called to it, and it felt so organic, and I just flowed right into it.
Oh, well, we're so grateful for you taking your lived experience to help other moms. So I'm curious, how many women have you helped as a doula?
As a doula today, well, shoot, I said I was going to put a number tracker on my website, but births, I'm up to 18. So
oh, that's so wonderful.
Birth and postpartum combined. Yeah.
That's so great. That's so great. I remember when I was having children, like doulas, so this was 20-ish years ago, and I was like, what is this doula thing? You know, and now it's just so common. It's so great to see.
Yeah. People are still learning, but it feels great to be in that space and helping other moms and families and birthing people, for sure.
Yeah. Well, thank you so much for sharing your story and for your advocacy work and your doula work. And I know you'll be with us on our advocacy day in March.
Will. Thank you so much. 3 years strong I've been here.
Super advocate. All right. So we're going to now turn to hear from Patience, who is a dependent or a spouse, and who also is affiliated with the Air Force, and who is, well, I'll let you tell your story, Patience. So welcome to Patience.
Hi, thank you so much for having me. Very, very excited to be here with you all today. Like was shared, my name is Patience Riley. I am a licensed professional counselor. I also am certified in perinatal mental health. I did not start out my military journey as an Air Force spouse. I actually started it as a Navy kid. That's how my parents met. My mother and my father, they met while they were in the Navy together. So I grew up Navy, and then my college sweetheart, which you all see right there, he ended up later on joining the Air Force, and we have two little boys. This is a current picture of us, 4 and 2, but a lot of my challenges happened earlier on. Um, so the lovely thing is, I feel like I'm just a military kind of through and through on the dependent side. Like I've had the experience as a military child. So when Tiara was mentioning, hey, I was working with these kids and I noticed some things that the kids went through with having somebody gone, not being there. Being a Navy kid, my dad was gone often, a lot. And so I remember having to deal with separation as a young child, but also that separation was very different now that I'm a spouse because I have a different kind of role as a dependent. But as a licensed professional counselor, because I have that personal connection with military families, I have always wanted to work with military families. I had the chance of working as a military family life counselor when we were stationed at Offutt Air Force Base in Nebraska. And it was a wonderful, wonderful, wonderful job. I absolutely loved it. But some of the things that I worked with my clients, I'm thinking back to the previous slide that Adrian shared of what people's statements and responses were. Folks would come into my office saying, hey, I'm having issues with my relationships. Hey, I'm having issues adjusting to this TDY or this deployment or this PCS, or trying to develop my community that we talk about as well. And at one point in time, I started to get a lot of folks that walked into my office and into my doors that were having issues because they were pregnant, because they were postpartum, or because they were post-loss. And this is service women, service men, as well as spouses. And then I became pregnant. So I started working with my clients kind of at the same time that I became pregnant in itself. And there was a lack of support around pregnant, postpartum, post-loss, infertility, and all of that. So I decided, hey, patients, you need to learn a little bit more about this particular piece as it relates to mental health, because my clients would say, hey, I looked at this up online and I never knew that there was something out there called postpartum depression. I don't really understand these thoughts that I'm having, but they're really, really scaring me. And no one told me. My doctor didn't tell me. My nurse didn't tell me. After I gave birth, no one let me know that this is something that could happen. So I felt like it was really my responsibility to get additional training in this area and to educate myself as a provider, and then someone who was also pregnant at the time, about what is like maternal mental health, perinatal mental health, all of those things. And that's when I came across an organization, Postpartum Support International. For those of us that are not familiar with PSI, PSI is a global organization that offers free resources. Yes, free resources to families. We offer over 30 plus free support groups, can get folks connected to resources in their area and things of that nature as well. And so I got a lot of education through PSI. And then I ended up having my first baby, the oldest one. And after I had my first baby, he did not sleep well. And a lot of us know when you aren't sleeping well, you aren't feeling well. And my mood, my emotions, anger, upset, just all of that I was having a hard time coping. I was having a hard time dealing. And I said, wow, I'm a therapist and I'm having challenges in this area. So I really felt like from after having him, I wanted to dive fully in and work specifically with perinatal mental health. And that's what kind of took me on my track and my journey. My husband did end up deploying 4 days after I found out about my first pregnancy. And then he ended up going off to officer training school when my oldest was 6 months. So I ended up PCSing by myself. I moved twice within that time period. I received a lot of support from my mom, my dad, but also oh, and PCS, for those that may not be familiar, that's us moving from place to place. But received a lot of support from my mom and my parents who kind of helped me along the way as well. With getting to them during those times of separation. But those are all risk factors and things that can impact our mental health. So once we kind of got back together as a family, I ended up going from Nebraska to Florida. I did receive training from PSI on perinatal mental health. I became a member of the Perinatal Mental Health Alliance for People of Color. And later on, as of now, I work for the Alliance as the communications manager, being able to assist with our mission of bridging the gap in perinatal mental health services for communities of color. But even before then, if you don't mind switching to the next slide, please. Even after, I've gotten all of this additional training, I'm able to support my clients. I am working strictly in private practice. We end up having another move, so another PCS, where I am currently. We are stationed at Robins Air Force Base in Georgia. We live in a small little town in Perry. So we ended up moving, and we ended up moving during the pandemic. So we talk about our military families and our military communities and villages and things of that nature. Well, during the pandemic, all of us will probably agree that we were told to stay away from each other, to keep our distance, to not really connect. So that makes it really challenging when you are new to an area and one, you're trying to figure out, where do I go to the doctor? Because I couldn't go to the doctor on base. I got sent off. How do I get connected to a dentist? How do I get connected to just a support network, a system, just anyone around me, my neighbors, when I'm told to stay away from them? So this can be very, very isolating. And then I became pregnant with the little one over there. The picture that you will see right here is probably 2 days before my husband deployed. So I shared with you all that with my first birth, my husband ended up leaving at that 6-month point. Now with my second birth, my husband ended up leaving when my youngest was about 3 months old and my oldest was about 2.5. Now, the difference between my first birth and my second was support. That was a huge thing. Now, we were a lot closer to our immediate families, but my immediate family didn't live down the street. They lived about 4 to 5 hours away. I did have some folks that were in Atlanta about an hour and a half away, but that's still a little bit on the day-to-day things. My saving grace was one of my coworkers. She lived in the area. She had reconnected with me as well. And I was able to get about a Saturday 1 or 2 from her during the time that my husband was deployed. And that was extremely helpful because what Adrienne shared, that 50% of spouses that can fall into the category of postpartum depression or any kind of let's think perinatal mental health complication. I fell into that. I fell into that 50%. We found out about a month in advance that my husband was leaving, and that's almost no time to plan for something like that. So my story with what you see up here, the red flags, the risk factors, those things really can impact the military family. A PCS, the pandemic, an unexpected deployment on top of just a deployment in general, but then also a lack of an immediate support and support system. That, I believe, was probably the biggest impact of my story. And I remember finding out when he was going to be deployed, I just said, I was doing so well. This is going to mess
Everything up. Yeah.
That's, gonna mess everything up. But that's where I think it's so important. And I'm so grateful that we have these times to have these conversations to show that sometimes it's not that you have done anything wrong. And it's not that the role that you're turning into or the role in your motherhood or parent journey, you're not doing anything wrong. Sometimes your circumstances can really change that trajectory of your story.
Absolutely. Absolutely.
So
And we expect military families to pick up and move, to deal with separation, to do it regularly. And this is like one of the biggest stressors in life is moving, starting a new job, new schools, new community, all of that. And so, it's no surprise that our military families really do experience these issues at significantly higher rates. So just another little tidbit, I actually started my career in mental health, maternal mental health with PSI as well. I was one of the volunteers in Virginia way back in the day. And I would handle calls and emails from moms, and a lot of times military moms, right? Virginia is home to Norfolk Naval Shipyard and Little Creek and, the big Army depots here. And so, it's really very happy to take those calls and emails. And can you just, Patience, tell us real quickly what PSI has for military mothers? I know there's a support group and providers, volunteer coordinators.
yes, absolutely. Absolutely. So PSI does have a military mom support group. Now, this is active, spouse, veteran, guard, reserves, name it all branches. I did start as a volunteer with PSI leading that group. Now I lead our mindfulness group for us now, but that is one. And we also have specialized coordinators. So our support coordinators, Adrian, thank you for bringing that up, are also broken down by branch, just because we know that sometimes different branches, like we call things different, we have different names. Sometimes they are similar, they're the same, but we also have specialized coordinators that can get folks connected to services that are branch specific to them as well. So
got it. Thank you. Thank you. And we'll share all of that information as in the follow-up as well. Yeah. So thank you, Patience, for sharing your story. I'm sorry that you two also experienced these illnesses, but I'm so glad that you're putting your lived experience to help other mothers through your work as a therapist and also with the Perinatal Mental Health Alliance for People of Color. So,
yeah, thank you for letting me be here to share it.
Oh, so grateful to you.
Thank you.
Okay, so we're going to switch gears a little bit now that we sort of have heard some of the impact of the military culture on moms. We're going to hear from two amazing women about some policy strategies that have been unveiled to help support these moms. So first up is Gabby Cavins from Military Birth Resource Network and Postpartum Coalition. So please welcome Gabby. And she's going to tell us about a doula pilot project in the military.
Absolutely. Thank you so much, Adrian, and thank you all for being here. As you can see here, I have two photos. I was in the Navy as, like Adrian, also a United States Naval Academy graduate. I had a very, very traumatic birth with my first son, who you see in that top picture, while I was active duty. And that got me into this work that I'm in now, really from a lactation standpoint. I was actually told after I out of my traumatic birth that I would not breastfeed because I was active duty, and active duty women don't do that. And that was a provider that said that to me after they saved my life. So from then on, I said, okay, nope, that's not going to happen. I'm going to get this done. So I went on to breastfeed him for 14 and a half months. And then it was very traumatic. I did not know that I was experiencing some postpartum post-traumatic stress, definitely postpartum anxiety. We were dual military at the time as well. And so the care piece kind of ties into this. And so throughout my journey, it took me 2 years to get help. And I'm so grateful actually to PSI. I spent some time in those groups and talking with individuals. And then, it fast forward, and I'll save you all my story, and you can find me and I can tell it another time, but I ended up having my second son. Was a physiological hospital birth. I had him 12 minutes after I got to the hospital, and it was the most healing experience. I went on to breastfeed him for 26 and a half months. And then you see that picture there, that was my home birth with my daughter, she's 18 months old. And so I'd come full circle into this, really having this traumatic near-death experience, forwarding on into this really, really fulfilling birth, and also being able to share this and to work on this from a policy standpoint. So next slide, please. Here we go. So the Doula Pilot Project, we also know it as the Childbirth and Breastfeeding Demonstration through TRICARE. So as we know, Medicaid has a similar program. TRICARE came on in the National Defense Authorization Act of 2021 and authorized this pilot to start. So as you see, it's a 5-year project meant to cover doulas and lactation providers for military families. And it started in the States in 2022. We'll see it open to overseas in 2025. The purpose of it is to study the impact, essentially. The interesting thing about this service is not available to individuals that are giving birth at the military treatment facility or an MTF, which is a huge problem and something my organization has been looking at and to change, just because it really does not, active duty service members who are giving birth do not get to benefit from this project from the doula standpoint. Now, the lactation standpoint, they do it, and I'll get into a little bit more specifics here on the next slide. But these individuals, providers, so doulas and lactation professionals, come in and they have to meet certain requirements. So as you see here, a couple of specifics on covered services. So labor doulas, postpartum doulas are not covered. So just labor doulas, IBCLCs and CLCs are certified lactation counselors. For the doula support, you're authorized 6 visits before and after birth, as well as labor support. And then for lactation support, as we all know, in accordance with the ACA, it's 6 visits, but this demonstration also covers breastfeeding classes that are given by what we call TRICARE certified providers. Now we've seen, I've had a lot of questions on, why are active duty members that are giving birth or beneficiaries that are giving birth to military hospital not allowed to have their doula covered. It's actually a legality in the term of TRICARE beneficiary. But again, like I mentioned, we're hopeful that changes. Next slide, please. So a couple issues and updates that we've seen on this, as I mentioned. So this started in 2022. So we're almost into year 2. And my organization, Military Birth Resource Network and Postpartum Coalition, put out a survey to providers and beneficiaries. And we said, what do you think? What's going on? And so these are some of the top things we've seen. So access to providers in the area and birth location. There are some barriers to getting certified under TRICARE. There's a lot of requirements that you have to meet. Particularly, for example, there are 5 organizations. You have to be certified as a doula under one of the 5 organizations that they have set. Reimbursement rate and time frame. So the reimbursement rate is particularly low compared to local rates, and also the time frame of getting reimbursed, billing inconsistency. So some codes work and some codes don't, because these codes actually don't exist in the system. They have to manually do these things, right? And then lack of training on the part of the contractor of the staff there. And a big piece of this for us, and something we've advocated, and those of you who follow us probably saw our big push. So thank you if you called your legislator on this. We did not get this in the National Defense Authorization Act of 2024 until we all made a million phone calls. And I'm very thankful to MMHLA for being our coalition member and helping us on this front. So we did get the change to include military treatment facilities in both the House and Senate versions of the NDAA for 2024. So we're hopeful when everyone sits down and passes this, we will get it. We will get it done. So active duty service members have this.
Yeah, I know, as Anita said in the chat, sometimes these things look good on paper, and then in actuality, because of all of these legal things and loopholes and things that we haven't thought of, they don't come through quite as we had hoped. But that's why they're demonstration projects, right? So we can figure out these things, right? And hopefully in the next iteration, make these improvements. Like you said, you've already added some changes in the NDAA for next year, right? And so we know sometimes these things are incremental rather than a big splash, but we're so grateful for you and for your organization for pursuing this and keeping the pressure on. And like you said, if it's advocates and we call, our elected officials work for us and they want to keep their jobs, and we are the ones who keep them in their jobs. And so when they hear from us about particular issues, it's good to see that they take action. So thank you for all of that. There was something I wanted. Oh, Gabby, would you talk just a little bit, just for a minute before we get to Jamie, about your experience with the hierarchy, right? As you were in the hospital, right? Your doctor was a senior person, and just to explain a little.
Absolutely. It's, and as Adrian kind of mentioned at the beginning of this, we have wonderful traditions, and the hierarchy exists for a reason. But when we go into the birth space where, we already, even in a civilian hospital, right, we already have our providers have positional authority over us, or we feel that way. Now you're coupling this situation with the fact that, your nurse is a lieutenant commander in the Navy and your OB is a captain or whatever the case is. And so this creates, whether it's conscious or unconscious, a situation of, in my head, it's drilled into you that I have to listen. They're my boss, right? I am in a very vulnerable position. They have told me that I must X, Y, and Z, rather than really considering the fact that you have rights in the birth space, that you have autonomy, that informed consent is important. All of that kind of falls underneath this idea of hierarchy because it's just drilled in your brains. And again, I did not consciously realize that until I started unpacking what had happened to me. And the fact that I allowed that system to kind of infiltrate my birth. And so that's something as providers, if we're supporting military families, or if you are a military family, to really consider and think about and figure out the best way for you to address that. And I know doulas have a big role in this of as we go, especially as we go into the military treatment facility, hopefully next year, how to help families navigate that. And that's something that we're working on, training on with MBR-MPC is getting birth providers to understand this if they are not in the military community.
Right, thank you. So MTF, just so everybody knows, an MTF is a hospital. Of course, the military has to come up with their own name for everything. And so I also want to point out and give Gabby a big round of applause. She is in Yokosuka, Japan, where it is what time? 2 in the morning, 3 in the morning?
2:53.
2:53. So thank you, Gabby, for being with us. And thank you so much for your work on bird dogging this pilot project. We're so happy to have an organization like yours advocating for it. All right, and we're going to switch gears now, and we're going to hear about a new pilot project that MMHLA is working to introduce. And so please welcome Jamie Zalaway-Belcito, who is not only MMHLA's founder, but she is now back in action as our Director of Policy and Partnerships. And so we've got some really exciting news to share. So welcome, Jamie.
Thank you so much, Adrian. Thrilled to be here. Love the interaction on the chat. Love the questions. I think that the conversation, which is really what I think today is, validates our lived experiences, whatever those are, and how we each are leaning in to change how we're treated, how we're seen, how we're able to take agency of our experiences, and how we're able to take care of our families, and where we go with our experiences to make sure that those that are going to come after us are receiving the care that we know that we have not been able to have ourselves. And the military is an incredibly unique place for all of the reasons that we've heard here today. And I just want to take a moment to say to our families who have served, to our families that are serving right now, our military officers and their spouses, their children, and our veterans. I wear my heart on my sleeve to say thank you for your time and sacrifice that's put in. Tiara, Patience, your stories were just amazing. And Gabby, thanks from the bottom of my heart. You are the reasons why we will continue to move forward and have incredible lived experiences to change the discourse on how policies are made. And that's what this is all about. That's why I'm here. I take the stories that I hear from the chat box, from everyone's involvement, and from the stories we're hearing today, so that we see things like the doula pilot project. We are seeing that there is breastfeeding support in the military, that they are listening and setting up parental leave, miscarriage leave. It's lived experiences, and the fact that women, I think, are the highest amount of enrollees right now into the military. We're changing discourse, and the military is an old dinosaur that needs a lot of work. But I always think little chips away at the iceberg here. And the good news is that if we go to, yeah, that's just a little slide about who I am. And if you want to know more, you can always email me. So thank you for that slide on me. We'll go to the next slide on really what the excitement is that we're working on. We here at MMHLA have been focused solely on policy that affects maternal mental health. It really is the intersection of mental health, maternal health, racial equity, social equity, access, rural health, who's receiving services, and infant mental health. And we knew that our military folks needed that support. And boy, we have the data and we have the backing, and it's a universal consensus that our military serving and spouses need that support. They deserve the support, they require the support, and we are pleased to be able to be presenting another pilot project. These pilot programs are always great because you get the money, you get the support, and then you show the goods at the end of those 5 years. You say, look, it works for long-term sustainability in our policy. So that's where we're going with this pilot project, working with the DoD to prevent. We all know that these are preventable mental health challenges 99.9% of the time, right? Or 100% deemed preventable, temporary and treatable. We're looking to integrate evidence-based perinatal mental health prevention programs within the constructs of what the DoD already has within their maternal and pediatric care programming. So you're at primary care. Where do we always go as parents after the baby comes? Your pediatrician. We'll probably put our own health on the back burner before we don't take our children to their pediatricians. So really looking at where, we always use this terminology, the low-hanging fruit. Where will the parents see a provider? Let's make sure we're having those conversations, and let's implement a program that will prevent maternal and parental mental health challenges through established health programs and women's clinics. And we are here supporting birthing people. We are using the terminology in these instances with maternal and women's clinics. And we'll go to that next slide. Let's continue to increase awareness. Clearly here, oh my gosh, I think our staff said we have 700 folks who enrolled for today's conversation. And if you tell one person who tells one person who tells one person, we continue to be mighty and continue to educate and increase awareness and education on the fact that our pregnant and postpartum service members and their beneficiaries deserve to know that this is not something that should be held inside, that it is normal. It's 1 in 5. It's the most highest experience complication of all pregnancy. And we know, based on folks who actually register on the perinatal depression scales, it's approximately 36%. But let's be honest, or I'll say it here, I knew how to not tell the truth on those screenings. And I think a lot of folks can say that they get away with the screening, but they are in need of help. Well, let us continue to take away the stigma and say, you are not alone. We're going to give you services. We're going to look to create an advisory panel within the military complex, and we are going to make sure that there's diversity and representation, and that these services are available in the United States. And that very long acronym, I don't know how to pronounce it. It's something with an O. Who wants to jump in there and say it? It's for all of the sites overseas.
OCONUS, out of the continental United States.
That's right.
OCONUS, yeah.
That's right. So
Yeah.
let use your voice. It's the power of lived experience and your strength. The military sounds very difficult. I'm a child of a veteran. I'm a grandchild of a veteran. You warrior women here, I can't say enough, because you continue to do the hard work, and we're going to change these outcomes for our military families. So thank you. I'm excited to see where we go next.
Thanks, Jamie. We're so excited about this pilot project. It has not officially been introduced yet, hopefully this week.
That's
We
right.
actually have a meeting up on Capitol Hill tomorrow, where we'll be celebrating this with the members of Congress who hopefully will be introducing it. So more to come on all of this. And so,
And if I may just
yeah,
jump in one more, sorry about that.
Nope.
Adrian is absolutely correct. I do want this group to know we have secured our sponsors,
yes,
and it will continue to be the way we approach things here by camera, in the Senate and the House, Republicans and Democrats. This is not a party issue. This is an everyone issue, and we need to make sure our military is ready and taken care of. And we will be also having a virtual advocacy day in March. So if anyone's not signed up on that newsletter here, sign up. We want your voices, because we're going to be looking to get this pilot program passed and funded.
awesome. Thank you, Jamie, for that news. We have about 10 minutes for some Q&A. If anybody wants to raise their hand. Oh, wait, sorry. These are the different programs that we will be sharing in the prevention program pilot project. So centering pregnancy, which is group prenatal care, which has been very effective at building community and helping prevent mental health conditions. And then there's 3 evidence-based programs that are specifically targeted at moms, typically in the 3rd trimester, with a little bit in the postpartum period, mothers and babies, roses, and PrEP. We have been uplifting those 3 programs for a number of years. They're extremely cost-effective and very effective at helping prevent postpartum depression in particular. So next slide. Do we have any others? Oh, right, some resources, right. And again, we will be sharing all of these slides. So you will have links to all of this information. PSI's military support groups, Gabby's organization, different podcasts, and Military One Source, all kinds of resources for our military families. We will also be sharing, of course, the slide deck and the recording and our new fact sheet on maternal mental health. So if anybody has a specific question that we could entertain now before we launch our quick poll. Actually, you want to go ahead and launch the poll while we do some questions? We just want to get some feedback on whether this has been effective and helpful. So only a couple of questions. I think actually just one question. But we're always looking for feedback, ways that we can bring more information, better information to uplift the field of maternal mental health. So I'm just going to scroll through the chat real quick to see if there's any questions in there. Thank you for the resources. Good feedback. Oh, there was something in the chat or the Q&A we answered. One of the unique things about the military is that often, particularly on base, there are positions that need to be staffed 24/7. And if you're a single parent or you're on your spouse is on deployment and you're in one of these positions, there's need for 24/7 childcare, which is sort of a unique aspect again of the military. And it's really hard to staff a childcare center 24/7. And so again, there's just so many different facets of life in the military that we can't even imagine as civilians, as those of us who, live in the civilian world. Any other thoughts from our panelists? You've been, listening and watching the chat. Anything that you weren't able to share during your conversation, please come off mute and share in here. Birth doula here from Juliet. How can you get involved? Hang on, Juliet. We're going to share everybody's contact information. There it is. You can connect with any of us, right? You've got all of our social media handles. Sign up for MMHLA's newsletter. We all have our websites with emails and all of that. And we can include all of our contact information when we send out the follow-up information as well. Any specific collaboration with the VA nationally? Well, so let me just talk for a minute. So the VA serves veterans, and women in the veteran community are the fastest growing population. There is a specific group that does reproductive mental health within the VA, and they handle mental health, everything from, pregnancy and postpartum, menopause, endometriosis, all kinds of things. And so there's a particular group of psychiatrists and other experts who work in this field in the VA. So that's a unique part of the VA system. Also, when we send out our new fact sheet, we include a lot of information about the VA. We were not able to do it here just because of time, but we have almost 2 pages focused on women veterans. And there are a number of specific support programs specifically for women veterans. Yeah. And we're just scratching the tidbit with the resources. There are so many resources for military families. Sometimes the trouble is finding the right resource, right? So sometimes it takes a little bit of effort, and that's where people like Tiara or patients who kind of know the military system can help a little bit. Yeah. All right, my fellow panelists, any parting words for our fabulous audience?
Use your voice, and if we missed something today, reach out to us.
Right.
That's it.
Jamie, did you want to give a pitch for our advocacy events in 2024?
Absolutely. We're going to be, again, virtual. So wherever you are, please know, like Gabby at 2:30 in the morning or to whatever time it is, doesn't matter where you are, participate. We are a force. We are a force of nature, and we are going to be asking for the support on this particular pilot program. We will be continuing to ask for our funding on the psychiatry access programs, which are out there right now. And the 24/7, and maybe we can put this in the chat here. There is a national 24/7 national maternal mental health hotline that anyone can call. And it is linked with 988. It's linked with domestic violence, sexual assault, military services. We are here to continue to uplift this issue. It's the #1 complication of pregnancies. It's the #1 cause of maternal deaths in the perinatal period. Let us continue to lean in. We want you to participate with us in March to continue to ask for funding for these programs in this new program here. And then there'll be other information in our newsletters that get sent out. So thank you.
Yep. So we hold a virtual advocacy day every March. And then this year, we will also be doing an in-person advocacy day in July. Postpartum Support International is having their conference in Washington, D.C. in July. And we thought all of these people are coming. Let's take them up to Capitol Hill. And so we'll be doing that as well. So sign up for our newsletter so you can stay abreast of all of that. I hear there's a ton of great questions in the chat. We'll try to answer all of those either now or let's see. I'm just scrolling through here. Such great comments for all of our wonderful panelists. Thank you. Great presentations, all of that. New Parent Support Group. Thank you, Susan. That is actually listed on our fact sheet as one of the great supports for new parents in the military. Yep. Patients or Gabby, I saw you both nod on that. Have you received services from them?
I did. With my first pregnancy, I actually had a nurse that came out to my home, was wonderful. I wish I could have utilized the service, but unfortunately during COVID, folks weren't able to come out to our houses, but it was a wonderful support. It's free. to you. My nurse came out. She helped me do little tips and tricks. I had a cranky, gassy baby, and she was like, pump the legs, do these things. And those things just really allowed me to get some sleep. So I would really utilize the resources also with the Readiness Center, whichever Readiness Center of whatever you're affiliated with, going and seeing what's available with like Give Parents a Break. I saw some folks putting that in there as well, seeing if there's any deployment resources and things of that nature that could assist and that could help.
Yeah, there's a quick question I wanted to address in the Q&A from Caitlin. So many women in the military have histories with high ACE exposures, that's adverse childhood experiences, and then are exposed to MST, which military sexual trauma. Right. And so she asks, are there any programs you recommend for trauma-informed perinatal mental health care? Oh, Patience, maybe you can answer that. Does PSI do specific training on trauma-informed care?
So we pull trauma-informed care into all of our training for providers. Now, there are specific providers. We do have a provider directory of folks that have received the perinatal mental health training. So my recommendation would be to kind of filter it out. If you are looking specifically for somebody that needs to do trauma work, or they're specializing in trauma work as well, that has that training, you can check the little box. As also, you can check the little box with like insurance and things of that nature if you're trying to look for TRICARE specific. But that would be at postpartum.net. You can kind of do that. And everyone who is listed in the PSI directory has the specialized training in perinatal mental health. So it kind of helps you there. And also, it's not just for therapists. So for instance, like if you're looking for a doula, if you're looking for a lactation consultant, if you're looking for a psychiatrist or an OB or a midwife or something like that, that has that specialized training, they can be listed in the directory as well.
Yeah. Okay, we are just about out of time. There's been some great questions. There was one about that I answered in the chat, including information about the maternal mental health hotline for the NPSP programs. Absolutely. You can go online, you can order little cards, which you could include in all the packets going out to new parents. I think that would be awesome. We've been advocating for the hotline to expand a little bit to be able to serve military families and veterans. And so we will continue to advocate for all of this, making sure that our nation's military families are supported, as well as all of our new mothers across our country. So I think we have a couple. Thank you, Susan, put in free 90-minute complimentary webinar presented by PSI, right? And the organization formerly known as 2020 Mom, now known as the Policy Center for Maternal Mental Health, is coming up. We are just about out of time. Do we have any additional slides that we need to show, or have we shown them all? I think we've shown them all. Thank you. So again, you will receive information from us within the next couple of days with all of this, the slides, our contact information, our new fact sheet. You can also go to our website where all of those things are posted. Please join me in giving a big round of applause to our terrific panelists and our behind the scene folks, Mia and Mara, for making all of this so successful. Thank you, everyone. Thank you for being with us, and have a great rest of the day wherever you are in the world.